Now broadcasting on Star Worldwide Networks, it's Healthy Senior Living with Smiles by Delivery. Healthy Senior Living explores all aspects of creating a happy and healthy senior lifestyle. As the premier mobile dental practice in Arizona, we have mastered the art of delivering the highest quality dental services in our patients' homes. This show will bring you an engaging and ongoing discussion with the leading voices in the field about the best options and strategies available to help seniors live healthy and comfortable lives. And now it's time for Healthy Senior Living with Smiles by Delivery.
Hello and welcome to Smiles by Delivery and Healthy Senior Living. I'm Roger Downey with co-host Michelle, and she's here today. I always want to try to date the time of the day, and it is afternoon, but I guess that's my broadcast background. I always want to talk about the time of the day. But anyhow, welcome again. We're both here and both ready to really interview some interesting people.
That's right. And we'll just say about the time of the day that it is the right time of the day.
Yes.
Because whoever's tuning in knows that they are in the right place to find out information about, services and healthcare opportunities that are available throughout the Valley. And we really do have so many interesting providers that are out there that it's wonderful to be able to bring these to folks' attention so that they really understand the range of options.
And a common characteristic mostly of our guests are that they do home visits, because Smiles by Delivery is one of those home visitors that bring dental care to you, great dental care. And our guest today is Dr. Keith Arbuckle. Now, Dr. Keith is a podiatrist, and he has some interesting aspects of his practice, and we're going to get to him here as we introduce you. Hi.
Hello, I'm Keith.
I know you are.
Thanks.
I'm Roger. At any rate, tell us about your practice in Surprise, right?
That's correct. It's out in Surprise. So I work with Surprise Medical Center, and that's out by Bell Road and Highway 303. And it's an excellent group of, we have nurse practitioners, doctors, all that share an office. And so I do clinical podiatry there in the office. I book surgery cases when needed, and we'll take care of that. And then I do 2 days of house call with our affiliated company, and that company is Sun Valley House Calls. And so I work with them 2 days a week as a podiatrist and go out to the community, mostly on the west side of Phoenix, and work with them.
So you're young. I can tell that just by looking at you. Younger than me, obviously. How long ago did you graduate from med school and do your internship?
Sure, great question. So that was in 2012. I graduated. I went to school here at Midwestern University for podiatry. After that, went up to Minnesota for residency. That was 3 years. And then I did a 1-year fellowship in Chicago, and so I've been down here practicing in the Valley for about 2 years now.
Dr. Arbuckle, I have to ask the burning question that's probably on the mind of a lot of our listeners, and that is, why did you want to be a podiatrist and touch people's feet and foot issues? What was your thinking that you decided this is how I'm going to make a difference in medicine?
Sure, great question, Michelle. I get asked that every day in a multitude of different ways. They don't know how to ask it, but so my friend's dad was a podiatrist where I went to college, and I got to know their family well and saw, what he was able to do, the lifestyle, being able to be a physician, and then kind of guiding how you want that to work. There's some podiatrists that want to do lots and lots of call and lots of surgery, and you can be up at the trauma centers doing that. You can do less of that. But the common thing that I liked about it was that I'm not in front of a computer all day. I'm out helping people, working with my hands, and I liked really what did it for me was going to his clinic and see him being able to help people, and they were walking out feeling way better, and really able to get back to playing sports, walking normally, getting back into dance, stuff like that. It was just kind of seeing that difference that, hey, here's a service that I could provide to other people where I don't, I'm not just doing something in front of a computer. I'm out helping people. So I love it. It's been a great choice.
That sounds like That sounds like a good fit. I can see the appeal of being out and meeting with people and certainly being able to help them right away so that they can get back to the activities that they find important. And I wonder if you might share with us maybe a story of a patient that you can recall, recently maybe that you went and did something that only you were uniquely gifted to do, but after doing whatever this procedure was, the patient was like, I feel so much better. Thank you. And I can get out and do whatever it was that they weren't able to do before you met with them.
Sure, be happy to. So one that comes to mind was a patient that had heel pain in their feet for years, and she wasn't able to do her job. She worked she'd clean hospitals like at night, and she had to start cutting back her hours, and that was kind of eating into her paycheck, and so it was really hard for her because she knew she needed time off her feet, but she didn't know if she took that time if it would really get her better or not. And so we talked about some things, and we ended up, for her, doing some physical therapy, lots of stretching. We got her to do some seated work for a little while, and then we got her some good orthotics in her feet. And she was much more comfortable. We got her back to work full time, and she's doing well. She has a big regimen. I make her do stretches and certain things that go along with having plantar fasciitis and that heel pain. But she's doing awesome. So yeah, it's great to be able to provide that.
Have we really ever determined why we get plantar fasciitis?
Great question. So there's different theories on it, but one of the main things we see that almost all patients with plantar fasciitis have is a tight Achilles tendon. So a lot of our treatment focuses on that tight Achilles tendon, and then in addition to that, no matter who it is, a lot of people that have that plantar fasciitis, and just so our listeners know, we're talking about pain like on the bottom of the heel, not necessarily the back of your heel, more the bottom of it. But a common thing is a small weight gain is often accompanied by that. So those are a few factors that we see walking around on these hard floors. Like in Arizona here, it's lots and lots of tile, and the weather's so nice that it feels good to have your shoes off. Where I'm from in Minnesota, it's not a problem. Everyone's wearing their shoes or some kind of indoor sandal all the time. But here, they want to be barefoot. They're on hardwood floors, and so that's a huge factor down here too.
Or wear flip-flops.
Yeah, flip-flops don't help the problem. That doesn't count as shoes.
Thinking back, and I've got a long history of thinking back, there are two areas of the body that have always caused me the most problem when I think about it as far as pain goes. That has been feet and mouths, with dental care and things. And I've taken care of those, thankfully, so I don't have those problems anymore. But I would imagine that most people can deal with foot pain for just so long, and then they really need to have it taken care of.
Yeah, I mean, absolutely. So there's just kind of aches and pains that people just kind of get through with, and then I call them, there's activities of daily living that people can no longer do because of this pain. So it's one thing when someone comes in and said, I like hiking, but I get some pain in my foot, halfway through the hike, it bugs me. That's one type of thing, but when it affects activities that are really important to you, then it's time that, something has to be done. Either they have to decide hiking to me and being that ambulatory is not that important, or we need to do something. So that's what we kind of look at when I talk to patients, is like, how does this really affect you?
And do you find that folks are a little bit reticent to seek out your help? Do you think they wait maybe too long with the symptoms that they have?
Yeah, absolutely. I've seen a lot where you ask them how long they've had pain for, and they'll say, oh gosh, I've had this for 8-10 years. I had orthotics made 12 years ago, and gosh, they were great and I was doing good, but I don't know, I've just lost track of this. And so yeah, people push that off. I think we all do that. We're all doing that. It's hard to take a little bit of time out of your day to figure out where to go, who to talk to, things like that. So it happens. I get that.
Which is why I think you coming in and seeing the patients in their home is such a convenience for them, because they don't have to, for some folks, it's something that they need to do to arrange travel to even get to a doctor. So knowing that you're able to meet them in their home is a great convenience. What do you think is maybe superior about your ability to go out and meet them in their location?
Sure, great question. So we just had a baby about 6 months ago, and my wife was a little bit past due, so it bumped up all our visits. We had to go in more frequently, and it was like 2 or 3 days a week. So I would go to work. My wife would have to find someone to watch her other 2 kids. She'd have to go get checked on. It was a busy waiting room, so I totally get that a lot of this is just not convenient for life and people's schedules and things like that. Family members have work. It's hard to arrange these things, so I try to keep that in mind, that hey, if there's something we can do in your home, let's do it. And so we're able to try to bring those services with us. So whatever we can do to bring it with us, I don't always bring everything with me the same day, but we're able to provide, most of the things that we can do in clinic, we can do in someone's home. If it's not a good environment for it, then maybe we have them in to the clinic to take care of something, and then most of the other visits we would do in their home. And I try to kind of lump those together so I can see more patients in one location on the same day so that I can provide that type of care.
When it comes to specialty care like podiatry, what is most important here is that you are familiar with the anatomy of the foot, because most primary care doctors just have general knowledge, right?
That's correct. So they do a great job. They do fantastic, but I just find that you look through, a lot of these chart notes, and a lot of these patients, they might be sicker. They have a lot of things going on, and so I feel grateful I'm able to come in and kind of help out with a portion of that care, and that's something I've learned, is that it's great to see a specialist, someone who that's what they see all day, every day. So if I have problems with blood pressure, stuff like that, I know who I'm going to. If I have problems with, this, that, or the other with my kids, we know who we're going to. But yep, it's seeing same things all day, every day. And from books that I've read, it's showing that that's really how you want to pick what doctor you go to, is what kinds of things are they seeing, how often are they seeing it.
You talked about how often are they seeing it, what kinds of things are they seeing. So tell us, what are the things that you're seeing? What are the most common issues with the foot that you see?
Sure. So I see a lot of the heel pain that we talked about, the plantar fasciitis, especially more in a care home setting or in the retirement community that we're in. I see people of all ages, but I do see quite a few people who are a little older who might be having some diabetic foot problems, some numbness or tingling in their feet. I see people, something as simple as dry skin and calluses. Bunions are really, really common. Believe it or not, a lot of ingrown toenails. We see that all the time. Fungal nails, really thick, hard to trim nails. We see those quite a bit.
Well, that's great that we've put these different ailments out there for our listeners to keep in mind. And now we're going to go to a break. But right before we do, why don't you give your contact information so folks at home are thinking, wow, the convenience of having a podiatrist come to my location would be phenomenal. Tell them how to reach you.
Sure. So I'm Dr. Keith Arbuckle. I'm at Surprise Health Clinic is our health clinic. And our phone number is 623-815-2900. And that contact information, it's the same company that does Sun Valley House Call, so they can get a hold of us either way.
Thanks, and we'll return in just a minute with Dr. Keith Arbuckle.
Healthy Senior Living will be back right after this. Sun Valley House Call is a network of fully licensed and credentialed physicians, specialists, nurse practitioners, and physician assistants that provide medical services to residents at home. Their team utilizes innovative equipment, best practices, and an advanced electronic medical record system to provide the best care leading to the best patient outcomes. Sun Valley House Call brings the doctor to the patient in assisted, independent, group home, and memory care communities. Working in partnership with laboratories, medical services, and pharmacies, Sun Valley House Call brings comprehensive on-site coordinated care to the residents, alleviating the stress and hassle of transportation and wait time issues often involved with doctor visits. Sun Valley House Call practitioners service patients who are homebound and require physician visits to provide ongoing care. SVHC delivers a comprehensive range of medical, diagnostic, and consultative services in addition to patient care coordination between families, nursing agencies, and home health services. To find out more about these services, please call 623-934-1245 or visit us at sv-hc.com. Have you ever wished you knew the story of your great-grandparents? Or maybe even your own parents? Hearing personal stories is an irreplaceable way of understanding our loved ones. Recording your story is a precious gift for future generations. Now there's a simple option for getting it done. Remembered Well is an audio recording service that easily preserves your cherished memories. In a few guided conversations, owner and personal historian Michelle Trent will help uncover your family's unique story. This custom narrative is then professionally edited, digitally preserved, and ready to share for generations. It's your story, told your way. Find out more at rememberedwell.com. Now, back to Healthy Senior Living with Smiles by Delivery.
And welcome back. Dr. Keith Arbuckle, a podiatrist, is here with us today. Here we go again. It's always that broadcast situation that I always want to talk about what time of the day it is. At any rate, what we were talking about before the break, Doctor, was the various kinds of problems you see. What are some of the treatments that you provide for your patients?
Absolutely. So that depends on how severe it is and what we're talking about. For something as easy as plantar fasciitis, or not as easy as plantar fasciitis, but something along those lines that's more in my clinical setting, we see people that come in with chronic heel pain. I see a lot of the athletic population from the Air Force Base coming up, and they're running a ton. They're on the really hard surfaces. And so we see quite a bit of it. With that, I really focus a lot on, like I mentioned before, they usually have a really tight Achilles that we need to get stretched out. We need to switch up their shoe gear. Sometimes their shoes look fine, but maybe they're a little bit older. They've been wearing them for 6 months or a year, whereas most like high-end runners, they're going to be changing their shoes out about every 250 to 400 miles. So if you think about that, the average American's doing about 6 miles a day. If you're having foot problems, you might want to consider changing up the shoes. I usually recommend an off-the-shelf arch support for starters. There's ones you can get where you step on these different mats at Walmart. Those are a bit overpriced in my experience for what you're getting. There's some from Target called Walk Fit that I like. I think they're about $20. You can find them at Target. And those will go right into most pairs of shoes. So that's pretty common to start with things like that. If someone continues to have pain up to that point, we will do some steroid injections if needed. Sometimes get them into physical therapy if there's some weakness in their lower extremities or they're really having problems with flexibility. Every once in a while, there's some surgical procedures we'll do, but that's maybe in 2% of the population. Do we need to talk about surgery for heel pain? And then do you want to talk about some other foot problems?
I was just going to say, I'm just sitting here as you're ticking those off. I've had that one, I've had that one, I've had that one. And I think most guys, and I would include almost women now because there's a lot of focus on exercise. The hardest thing to do when you have a foot problem is rest the foot if you're an athlete. You know what I'm talking about. Because you you live by that running. You want to be able to run. And when you can't run, it's almost like, what do I do?
So it brings up a great point, and I'm the same way. So I don't want any of my athletes to give up on what they're doing, or more importantly, any of our seniors who like to do some walking and need to be out in the community. You can get rest just from switching from a really bad shoe to a better shoe with an insert. They're going to be getting some rest doing that. If you want to be outside exercising, great, jump on a bike. That's much lower impact than what you're going to have if you're out walking a lot or running. So people can still exercise a ton. You can get out and swim. You can bike. Elliptical is good. It's a little more impact, but not as much as walking. So we talk through that. There's a lot of things people can do. They can still be super active. They can still do things at the gym. So that's usually not an issue.
I'm going to leave the woman's shoe question to you, because you at least have more experience with that, obviously, than me.
I would hope so, Roger. I would hope so, yeah. And, yeah. So women, we have been known to wear shoes because they're really cute, even though they're really uncomfortable. So you, as the professional, the doctor, are you going to say that women should not wear these 4 to 5 inch heels, flip-flops? What are the shoes that you're saying should probably be banned from our closets?
Sure, Michelle. So I've actually been telling women for years that people don't really care about their shoes. And
what?
But Michelle, I had one of my friend's wife came up to me and she said, people have been coming up to her and said, why are you wearing those shoes in this setting? And so I know it matters. It does. I'm learning, right? So it depends on the thing. So there's, in some circumstances, I don't think we need to cut out all shoes all the time. But for some people, if they're walking a bunch, you put on your walking shoes at that time. If you're getting to work and there's something at work you need to be in a certain shoe for and need to be presentable, I get that. So maybe 5 to 20% of the time you're in this other shoe, but for the most part and at home you're in a much more comfortable shoe and you're going to feel better. So I don't believe in being, that guy who's just saying, no, you can't ever do this, you can't ever wear this shoe, because I know what it's like to be on the other side of the coin, where in reality you're going to be just fine if you sneak into whatever shoe you want for a little while. But if for the most part you're in a really good shoe, you're going to be fine.
Okay, so you have heard it here. You can still wear the cute, trendy leopard print shoe because our resident podiatrist just told us that it was okay.
With some exceptions.
With some exceptions. Always a
What are those exceptions?
So like I said, it depends on if you're having foot problems. If you're not having any foot problems, I don't chase people down and tell them to wear better shoes.
But if they were wearing stilettos, you could totally catch them if you were chasing them. It would be easy to do.
I could easily catch them, yeah.
Easily, yeah.
I've always wondered about ballet dancers and the pressure that they put on those toes. And, that has to cause a problem with them over time, if not when they're in their 20s, generally in their later years.
So I've met podiatrists that have worked with professional ballet dancers. It's funny that you bring that up. And they wanted to see what is, how messed up are these feet? Well, they're finding that people who can make that cut all the way through to do that professionally, they're only people that have really healthy feet. They've got good anatomy, and they don't really have many problems to speak of. Because anyone with any problems, they get weeded out earlier on. So people that they've got a big bunion or something that's going to be a problem, they're not going to make it because it's just such an intense activity that they're weeded out far beyond that. So when you look at a lot of the professional ballet dancers, from what I'm told, they have very few foot problems.
Surprising.
Yeah, that's interesting.
You've mentioned bunions a number of times. Is a bunion a dislocated toe bone, or what is that?
Yeah, so people ask that all the time. What is a bunion? What's this big lump on my foot? So what you're looking at if you see a bunion is by that big toe joint, you're going to have that lump, but it's not a bunch of extra bone that grows there. It's the joint that's deviated. It's out of alignment. And what happens is there's a lot of muscles that want to pull that big toe over towards the other one to stabilize the foot. And so when they all start firing, that big toe moves over, and that joint kind of falls out of alignment. And so that's what it is. So a lot of people say, Dr. Arbuckle, can you just shave this chunk of bone off my foot and I can go back to work really soon after? Well, it's a little more involved than that, because we need to reposition that joint to a position that's going to be healthier for you.
And that's a surgical operation, right?
That would be surgical, yeah.
Is there something you can do before you get to the point of needing surgery?
There's some people that will say, okay, so if a bunion is something that you see and comes because of compensation and an unhealthy foot, you can try arch supports in the shoes to support the foot so that it's not unbalanced. If you can do that early on, some people feel that there's a role for that. I find a lot of times if you're jamming big orthotics or inserts into shoes, it takes up more room in the shoe, and that bump that's there, you're going to be pressing harder against the shoe, and it can cause more pain to do orthotics sometimes, but really not much to speak of. There's a lot of pads and different things like that you can find over the counter. None have been shown to straighten out a bunion. So you can wear wider shoes. That's really helpful, but it's not going to prevent your bunion.
One of the other things that is not altogether uncommon are when people will break a toe, like that pinky toe that's out there and meets the bedpost, really unfortunately, at night. Is there anything that can be done for broken toes, or is that a rest and tape them up kind of a scenario?
Sure. So, great question. It depends on what happened to it. If it's dislocated or it's in a bad position, you need to really, if it's in a terrible position, we need to try to straighten that out. Sometimes that involves surgery. Many times not. You can wrap it with what's called Coban, and it's kind of an elastic material that sticks to itself, and that will give just a little bit of compression to that toe, because if you've ever tried to wrap a toe with Ace Wrap, it doesn't work. So you can do that. Compression socks are helpful too, because they're going to give a little compression to your toes, but that's just trying to avoid things that are going to be painful for it. Slow down, stop your running and things like that for a while, because it's going to hurt until you get that toe better.
That's an amazingly painful kind of thing. It's shocking to think that little pinky toe can pretty much put you out of commission.
Absolutely. But it happens all the time. I mean, you got to think of how often I might do a small surgery for like a little hammer toe of the fifth toe. It happens. So just that discomfort's enough to make it to where you can't get out and do the things you need to do, wear the shoes you need to wear.
I know how painful that is, not the pinky toe. I've had another toe that I broke. But anyhow, I also had a big toe dislocated playing tennis. That's great when you look down at your foot and all the toes are in their normal place except the big toe, and it's sticking straight up. So that one had to be dealt with. I couldn't walk very far with that one, but it's always a great opportunity to have someone in your specialty. Obviously, we've never had a podiatrist on Healthy Senior Living before. Dr. Keith Arbuckle has been our guest. It's been a pleasure having you here. I've learned a lot about foot pain, and I'm sure Michelle has as well. And we hope that you'll join us the next time for the next Healthy Senior Living with Smiles by Delivery.
Thank you for listening to Healthy Senior Living with Smiles by Delivery, the premier mobile dental practice in Arizona. Catch the show live each week at this time or 24/7 anytime on demand on StarWorldWideNetworks.com.